here barking. You know, it's time for Vet on the Set, and we have Dr. Richard Fujie here, the co-owner of the King Street Pet Hospital, here to talk about cancer in dogs. Good morning to you.
Good morning.
Who do we have here today?
This is Lulu. She's a 4-year-old Havanese.
Yeah, and she's very well behaved.
Very well behaved.
She's very healthy. She does not have cancer. But we wanted to talk about what we should be looking for. What are some of the symptoms we might find as a pet owner if our dog has cancer?
You might feel lumps and bumps in their body, you know, like lymph nodes may be enlarged, or it might be skin lumps. And so if you feel bumps to the abdomen, yeah, come and see us right away.
So even if they're small?
Yeah.
Make sure to get those checked.
Right, because you know, if they're small, we can take care of them a lot easier if they're large. Yes, so don't wait, and they can metastasize too sometimes. Yeah.
Okay, and I think we had some video showing a kind of a demonstration. This is not a real needle; it's actually just plastic to show us kind of how you would do a biopsy.
This is called a fine needle aspirate, and so we just use a syringe with a needle. And again, like we said, this is a plastic needle, so it's not poking the dog, which is a demonstration. So usually the first step, in case we find a large lymph node, we'll do a fine needle aspirate with get a small sample and send to a lab, a smear to the lab, and they can be diagnostic at times. Other methods would be like using a true cut needle, where we actually put some sedation and we actually put a special needle into that area and cut a small wedge of tissue out. And of course, we can always knock them out and then get a wedge of tissue with a blade. That's the most accurate. But usually the first method is quite accurate.
So once you're diagnosed, your dog is diagnosed, what then?
Well, if it's lymphoma, then we have to act fast because it's a fast-acting type of cancer. Chemotherapy works really good. It's one of the most reactive. I mean, they respond the best to chemotherapy. So if a dog comes with lymphoma, I always twist arms to have them treated. There's different levels of treatment. The more expensive, effective treatments, about 95% into remission. Other methods may not be as successful, but it can be a lot more economical.
How do you wrestle with that as a pet owner between the cost and not wanting your dog to suffer? You don't want to, make their lives longer if they're doing well, right?
Right. It's a balance. Age is a factor. I mean, the dog's 18 years old and has a cancer that's aggressive. Perhaps chemotherapy is not a good choice. But if it's a young dog, 4 years old, like for instance, we had cancer in this dog. I would really push for a good chemotherapy. Yeah.
Okay, but there's a lot of options that maybe people have not thought of from before.
Right. Your doctor can help you with that. We also have veterinary oncologists in the city now, so they can, their specialists can help you.
Wow.
Yeah.
These dogs have everything now.
Right.
All right, Dr. Fujie, thanks for being here today.
Thank you.
All right, and thanks, Lulu. And that's your Vet on the Set. Yeah, say hi, say hi. We'll be right back. You're watching Sunrise on Hawaii News Now.